Question 1. Risk assessment procedures indicate that a patient scheduled for cataract surgery has a history of mild glaucoma and is prescribed a topical steroid eye drop for preoperative use. The physician's order specifies prednisolone acetate 1% QID, but the patient reports experiencing significant ocular discomfort and redness with this concentration in the past. The COMT is responsible for administering preoperative medications and educating the patient. What is the most appropriate course of action for the COMT? Option A. Administer the prescribed prednisolone acetate 1% QID as ordered and instruct the patient to report any severe discomfort. Option B. Contact the ordering physician to discuss the patient's history of discomfort with the 1% concentration and inquire about potentially adjusting the dosage or considering an alternative medication for preoperative management. Option C. Administer a lower concentration of prednisolone acetate, such as 0.12%, without consulting the physician, assuming it is a safer alternative. Option D. Inform the patient that they must tolerate the medication as prescribed, as it is essential for surgical success, and refuse to administer it if the patient expresses significant distress. Correct answer is A. Administer the prescribed prednisolone acetate 1% QID as ordered, and instruct the patient to report any severe discomfort. Explanation. This scenario is professionally challenging because it requires the COMT to balance patient safety, adherence to physician orders, and the ethical imperative to advocate for the patient's well-being within the scope of practice. The COMT must recognize potential complications and proactively address them, rather than passively following instructions that might be suboptimal or even harmful. The correct approach represents best professional practice because it prioritizes patient safety and informed consent, which are fundamental tenets of ophthalmic care and are implicitly or explicitly supported by COMT certification standards and general medical ethics. This approach involves clear communication with the physician, ensuring the patient understands the procedure and potential risks, and documenting all interventions. This aligns with the principle of beneficence and non-maleficence. An incorrect approach that involves proceeding with the procedure without clarifying the physician's intent regarding the specific medication dosage, or without ensuring the patient's understanding of the risks associated with a potentially higher concentration medication, fails to uphold the standard of care. This could be considered a breach of professional responsibility and potentially negligent if an adverse event occurs. It neglects the COMT duty to question and clarify when patient safety is potentially compromised. Another incorrect approach, such as delaying the procedure indefinitely without communicating the concerns to the physician, also fails to meet professional standards. While caution is warranted, indefinite delay without clear communication can negatively impact the patient's outcome and disrupt the surgical schedule, potentially leading to patient dissatisfaction and compromising the physician's treatment plan without a valid communicated reason. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the potential issue. Recognize any ambiguity, potential risk, or deviation from standard practice in physician orders or patient presentation. 2. Consult and clarify. Immediately seek clarification from the ordering physician regarding any uncertainties. Document this communication. 3. Patient education. Ensure the patient fully understands the procedure, any associated risks, benefits, and alternatives, especially if there are any modifications or concerns. Obtain informed consent. 4. Document thoroughly. Maintain accurate and detailed records of all assessments, communications, interventions, and patient education. 5. Escalate if necessary. If concerns remain unresolved or if patient safety is still at risk after clarification, follow established protocols for escalating the issue to a supervisor or appropriate authority. Question 2. The control framework reveals that a certified ophthalmic medical technologist, COMT, is tasked with assessing a patient presenting with symptoms of ocular discomfort and intermittent blurred vision. While initial visual acuity is within normal limits, the technologist observes subtle irregularities in the patient's eyelid margins and a mild conjunctival injection. Which of the following approaches best reflects the required scope of practice and professional responsibility in documenting these findings? Option A. Thoroughly document the observed eyelid margin irregularities and conjunctival injection, noting their characteristics and location, and report these findings to the supervising ophthalmologist as part of the comprehensive patient assessment. Option B. Briefly mention eyelid irritation and redness in the patient's chart without further detail, as these are minor findings unlikely to be the primary cause of blurred vision. Option C. Advise the patient on over-the-counter remedies for eyelid inflammation and suggest they return if symptoms worsen, without consulting the ophthalmologist. Option D. Focus exclusively on the visual acuity and refractive error, as these are the most direct indicators of vision impairment, and consider the eyelid and conjunctival findings secondary. The correct answer is A. Thoroughly document the observed eyelid margin irregularities and conjunctival injection, noting their characteristics and location, and report these findings to the supervising ophthalmologist as part of the comprehensive patient assessment. Explanation. Scenario analysis. This scenario presents a professional challenge because the technologist must interpret subtle clinical signs related to the accessory structures of the eye, which can be indicative of underlying pathology. The challenge lies in accurately assessing these structures, understanding their potential implications for vision, and documenting findings comprehensively, all within the scope of practice and regulatory guidelines for a COMT. Misinterpretation or incomplete assessment could lead to delayed diagnosis or inappropriate management, impacting patient care. Correct approach analysis. The correct approach involves a systematic and thorough examination of the accessory structures, including the eyelids, conjunctiva, lacrimal apparatus, and extraocular muscles. This approach is best professional practice because it aligns with the COMT role in gathering objective data that contributes to the ophthalmologist's diagnosis and treatment plan. Regulatory and ethical guidelines mandate accurate and complete patient assessment. By meticulously documenting findings such as eyelid position, presence of inflammation or lesions, tear film quality, and extraocular muscle motility, the technologist provides essential information for a comprehensive ophthalmic evaluation. This adheres to the principle of providing competent and ethical patient care. Incorrect approaches analysis. One incorrect approach is to focus solely on the primary visual pathway, cornea, lens, retina, and neglect a detailed assessment of the accessory structures. This is a regulatory and ethical failure because it represents an incomplete patient evaluation, potentially missing critical diagnostic clues. COMT scope includes the assessment of all relevant ocular and adnexal structures. Another incorrect approach is to make a definitive diagnosis or recommend treatment based on findings in the accessory structures. This is a significant ethical and regulatory violation, as diagnosis and treatment are the exclusive purview of the licensed ophthalmologist. The COMT role is to collect and report data, not to interpret it diagnostically or therapeutically. A third incorrect approach is to document findings superficially or inaccurately. This compromises the integrity of the patient record and can lead to miscommunication between healthcare professionals, violating professional standards of care and potentially leading to patient harm. Professional reasoning. Professionals should approach patient assessment with a structured methodology, ensuring all components of the examination are addressed according to established protocols and scope of practice. When evaluating accessory structures, the technologist must consider the potential impact of any abnormalities on visual function and overall ocular health. This requires a deep understanding of ocular anatomy and physiology, as well as the clinical significance of various findings. Decision-making should be guided by the principle of do no harm and the commitment to providing the highest quality of patient care. If any findings are equivocal or suggest a significant pathology, the technologist should clearly and accurately report these to the supervising ophthalmologist, facilitating timely and appropriate medical intervention. Question 3. Risk assessment procedures indicate a patient presence with a history of myopia and astigmatism, reporting that their current glasses, prescribed 2 years ago, feel less clear than they used to, despite no reported changes in visual acuity testing during their last annual exam. The patient is adamant that their vision has worsened. What is the most appropriate course of action for the certified ophthalmic medical technologist, COMT, to take regarding the refractive assessment? Option A. Advise the patient that since their last annual exam showed stable visual acuity, their current glasses are likely still appropriate and no further refractive testing is immediately necessary. Option B. Rely solely on the autorefractor readings for the new prescription, as these provide objective data, and inform the patient that the autorefractor is the most accurate measurement available. Option C. Trust the previous annual exam's visual acuity testing and assume the patient's perception of less clear vision is subjective, proceeding with a minor adjustment to the current prescription based on their subjective feedback alone. Option D. Perform a new, comprehensive manifest refraction, meticulously documenting all subjective and objective findings, and compare them to the previous prescription, noting any discrepancies and the rationale for any proposed changes. The correct answer is D. Perform a new, comprehensive manifest refraction, meticulously documenting all subjective and objective findings, and compare them to the previous prescription, noting any discrepancies and the rationale for any proposed changes. Explanation. Scenario analysis. This scenario presents a common challenge in ophthalmic practice, accurately assessing and documenting refractive error in a patient with a history of previous, potentially inaccurate refractions. The challenge lies in balancing the patient's subjective experience and reported visual acuity with objective findings and established clinical protocols. A failure to meticulously document the process and rationale can lead to miscommunication, inappropriate prescription adjustments, and potential patient dissatisfaction or suboptimal visual outcomes. Adherence to established standards of care and regulatory guidelines is paramount to ensure patient safety and professional accountability. Correct approach analysis. The correct approach involves a systematic and thorough reevaluation of the patient's refractive status, prioritizing objective measurements and careful subjective refinement. This includes performing a new manifest refraction, meticulously documenting all findings, and comparing them to previous records. The rationale for any prescription change must be clearly articulated and supported by the examination data. This aligns with the COMT responsibility to perform accurate diagnostic testing and contribute to the development of a comprehensive treatment plan, as outlined by the Joint Commission on Allied Health Personnel in Ophthalmology, JCOPO, practice patterns and ethical guidelines, which emphasize patient care, accuracy, and clear communication. Incorrect approaches analysis. One incorrect approach involves solely relying on the patient's subjective report of improvement with their old glasses without performing a new refraction. This fails to account for potential changes in the refractive error or the possibility that the patient's perception of improvement is influenced by factors other than an accurate refractive correction. Ethically and regulatorily, this bypasses essential diagnostic steps and could lead to an outdated or incorrect prescription. Another incorrect approach is to assume the previous refraction was accurate and simply adjust the new prescription based on minor subjective changes without a full reevaluation. This neglects the possibility of errors in previous measurements or the progression of the patient's refractive condition. It violates the principle of independent verification of diagnostic data, a cornerstone of responsible ophthalmic practice. A third incorrect approach is to prescribe based on a single objective measurement, e.g., autorefractor, without subjective refinement. While autorefractors provide a starting point, they do not account for individual visual needs, binocular interactions, or accommodative status, all of which are critical for a functional prescription. This approach is incomplete and potentially leads to a suboptimal visual outcome, failing to meet the standard of care for a comprehensive refractive assessment. Professional reasoning. Professionals should approach such situations by first acknowledging the patient's history and concerns. The next step is to initiate a complete, independent diagnostic workup, starting with objective measurements and proceeding to subjective refinement. All findings, including discrepancies with previous records, must be meticulously documented. The rationale for any proposed prescription change should be clearly explained to the supervising physician, supported by the objective and subjective data obtained. This systematic process ensures accuracy, patient safety, and compliance with professional standards. Question 4. Stakeholder feedback indicates that some patients report experiencing transient visual disturbances, such as flashes of light or shimmering patterns, which they do not associate with any specific ocular discomfort. Given the potential for such symptoms to be related to the visual cortex, what is the most appropriate course of action for a certified ophthalmic medical technologist, COMT, when presented with this information? Option A. Dismiss the reported symptoms as non-ophthalmic and therefore outside the scope of practice for an ophthalmic technologist. Option B. Advise the patient that these symptoms are likely age-related and not of significant concern for an ophthalmic examination. Option C. Suggest over-the-counter eye drops or supplements that may help alleviate visual disturbances. Option D. Document the patient's reported visual disturbances thoroughly and recommend a referral to a physician or neurologist for further evaluation. Correct answer is D. Document the patient's reported visual disturbances thoroughly and recommend a referral to a physician or neurologist for further evaluation. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified ophthalmic medical technologist, COMT, to interpret and act upon potentially ambiguous or incomplete patient information related to visual cortex function. The challenge lies in discerning the most appropriate course of action when a patient's subjective report of visual disturbances, while not directly observable, could indicate a serious underlying neurological issue impacting the visual cortex. The COMT must balance the need for thorough patient care with the limitations of their diagnostic scope, ensuring that appropriate referrals are made without overstepping professional boundaries or causing undue patient anxiety. Careful judgment is required to differentiate between common visual artifacts and symptoms suggestive of more significant pathology. Correct approach analysis. The correct approach involves recognizing the potential significance of the patient's reported visual disturbances, even if they are subjective and not immediately quantifiable through standard ophthalmic testing. This approach aligns with the COMT ethical obligation to advocate for patient well-being and to ensure comprehensive care. By documenting the patient's symptoms thoroughly and recommending a referral to a physician or neurologist, the COMT is acting within their scope of practice. This ensures that a qualified medical professional can further investigate the potential neurological implications of the visual symptoms, which may originate in or be affected by the visual cortex. This proactive referral is best professional practice as it prioritizes patient safety and facilitates timely diagnosis and management of potential conditions affecting the visual cortex. It adheres to the principle of do no harm by seeking expert evaluation for symptoms that could indicate serious pathology. Incorrect approach is analysis. Dismissing the patient's symptoms as non-ophthalmic and therefore outside the COMT purview is a regulatory and ethical failure. While the COMT primary focus is the eye, symptoms originating from or affecting the visual cortex can manifest with visual disturbances. Ignoring such reports could lead to a delay in diagnosis of serious neurological conditions, violating the ethical duty to provide diligent care. Attributing the symptoms solely to age-related changes without further investigation is also problematic. While age can affect vision, subjective visual disturbances can be indicative of more specific neurological issues impacting the visual cortex. This approach fails to acknowledge the potential for underlying pathology and represents a lapse in thoroughness, potentially leading to misdiagnoses. Suggesting over-the-counter remedies for visual disturbances without a physician's diagnosis is a significant ethical and regulatory failure. This constitutes practicing medicine without a license and could mask or exacerbate a serious underlying condition affecting the visual cortex. The COMT role is diagnostic and supportive, not therapeutic in the absence of a physician's prescription or order. Professional reasoning. When faced with subjective patient complaints that may have neurological implications, a COMT should employ a systematic approach. First, thoroughly document the patient's reported symptoms, including their nature, duration, frequency, and any associated factors. Second, conduct all relevant ophthalmic examinations within the COMT scope of practice to rule out ocular causes. Third, if ocular causes are not evident or if the symptoms strongly suggest a neurological origin affecting the visual cortex, the professional decision-making process dictates a clear and timely referral to an appropriate physician or neurologist for further evaluation. This ensures that the patient receives comprehensive care and that potential serious conditions are not overlooked. Question 5. The assessment process reveals a patient complaining of intermittent double vision and a noticeable droop in one eyelid. During the examination, you observe that the patient's pupils are equal in size and react briskly to light, but there is a significant limitation in upward and outward gaze of the affected eye. Considering the innervation and function of the cranial nerves involved in ocular motility and pupillary control, which of the following actions best reflects your professional responsibility in this situation? Option A. Provide the patient with a preliminary diagnosis of a specific cranial nerve palsy and advise them on potential treatment options based on your interpretation of the motility deficits. Option B. Document the observed limitations in ocular motility and the normal pupillary responses, noting the patient's reported symptoms, and present this comprehensive data to the supervising ophthalmologist for further evaluation. Option C. Focus solely on the normal pupillary findings, as this indicates no immediate threat to vision, and inform the patient that their double vision is likely temporary and will resolve on its own. Option D. Document the limitation in upward and outward gaze, but disregard it as a secondary finding, prioritizing the normal pupillary reflexes as the primary indicator of neurological health. The correct answer is B. Document the observed limitations in ocular motility and the normal pupillary responses, noting the patient's reported symptoms, and present this comprehensive data to the supervising ophthalmologist for further evaluation. Explanation. The assessment process reveals a patient presenting with symptoms suggestive of a cranial nerve deficit affecting ocular motility and pupillary response. As a certified ophthalmic medical technologist, COMT, the technologist is tasked with gathering accurate diagnostic information. This scenario is professionally challenging because it requires not only technical proficiency in performing ophthalmic tests, but also a nuanced understanding of neuroanatomy and physiology to interpret findings correctly and communicate them effectively to the supervising ophthalmologist. The ethical imperative is to ensure patient safety and facilitate accurate diagnosis and treatment by providing precise and relevant data. The correct approach involves meticulously documenting all observed signs, including any deviations from normal ocular motility, pupillary size and reactivity, and visual acuity, and correlating these findings with the patient's reported symptoms. This approach represents best professional practice because it adheres to the COMT scope of practice, which includes performing and documenting diagnostic tests under the supervision of an ophthalmologist. By providing a comprehensive and accurate report, the technologist directly supports the ophthalmologist's diagnostic process, ensuring that treatment decisions are based on sound clinical evidence. This aligns with the ethical principles of beneficence and non-maleficence, as it aims to benefit the patient by facilitating correct diagnosis and avoiding harm from misdiagnosis or delayed treatment. Furthermore, it upholds professional integrity by demonstrating competence and diligence. An incorrect approach would be to focus solely on one aspect of the examination, such as pupillary reflexes, while neglecting to assess ocular motility. This failure to conduct a complete and thorough examination would be a significant professional and ethical lapse. It could lead to an incomplete diagnostic picture, potentially causing the ophthalmologist to miss crucial information necessary for diagnosis, thereby violating the principle of non-maleficence. Another incorrect approach would be to offer a preliminary diagnosis or interpretation of the findings to the patient. This oversteps the COMT scope of practice, which is to collect and document data, not to diagnose. Such an action could cause undue patient anxiety, lead to misinterpretations, and undermine the authority and role of the supervising ophthalmologist, violating professional boundaries and potentially causing harm. A third incorrect approach would be to dismiss subtle findings as insignificant without proper documentation and reporting. This negligence could result in overlooking early signs of a serious neurological condition, directly contravening the duty to act in the patient's best interest and potentially leading to significant harm. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly review the patient's chief complaint and history. Second, execute all relevant diagnostic tests with precision and attention to detail, ensuring the equipment is calibrated and functioning correctly. Third, meticulously document all findings, including normal and abnormal results, using objective and precise language. Fourth, critically analyze the collected data in the context of the patient's symptoms and known ocular anatomy and physiology. Finally, communicate all findings clearly and concisely to the supervising ophthalmologist, highlighting any significant observations that may require immediate attention. This structured approach ensures that all necessary information is gathered and presented, enabling the ophthalmologist to make an informed diagnosis and treatment plan. Question 6. Stakeholder feedback indicates that patients often express confusion regarding the specific anatomical structures involved in their visual complaints. A patient reports experiencing gradual blurring of vision, particularly noticeable when reading. They ask, "What part of my eye is making it hard to see clearly when I look at small print?" Based on your understanding of ocular anatomy and physiology, which of the following explanations best addresses the patient's question within the COMT scope of practice? Option A. You should consider getting prescription glasses to improve your reading vision. Option B. Your vision is blurry because the light isn't reaching the back of your eye properly. Option C. You likely have cataracts, which is a common condition where the lens of your eye becomes opaque. Option D. The lens inside your eye is responsible for focusing light onto the back of your eye. When this lens becomes cloudy or less flexible, it can scatter light and make it harder to see fine details clearly. The correct answer is D. The lens inside your eye is responsible for focusing light onto the back of your eye. When this lens becomes cloudy or less flexible, it can scatter light and make it harder to see fine details clearly. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the COMT to interpret and apply knowledge of ocular anatomy and physiology in a context that directly impacts patient care and communication. The challenge lies in accurately identifying the anatomical structure responsible for a specific visual symptom, and then communicating this information effectively and ethically to the patient, ensuring they understand their condition without causing undue alarm or providing medical advice beyond their scope. The COMT must navigate the delicate balance between providing informative explanations and respecting the physician's role in diagnosis and treatment. Correct approach analysis. The correct approach demonstrates best professional practice by accurately identifying the anatomical structure, the lens, responsible for the described symptom, blurry vision due to opacification, and explaining its function in a clear, patient-friendly manner. This aligns with the COMT role in assisting the physician by gathering and relaying information. The explanation focuses on the physiological process of light refraction and how opacification interferes with it, which is within the COMT's scope of knowledge. This approach is ethically sound as it educates the patient about a potential cause of their symptom without diagnosing or prescribing. It respects the physician's ultimate authority while empowering the patient with understanding. Incorrect approaches analysis. One incorrect approach might involve the COMT immediately stating the patient has cataracts. This is a regulatory and ethical failure because it constitutes a diagnosis, which is outside the COMT scope of practice. Diagnosing is the responsibility of the licensed physician. Another incorrect approach could be to simply state, "Your vision is blurry," without any anatomical or physiological explanation. This fails to leverage the COMT expertise and does not adequately inform the patient, potentially leading to confusion or anxiety. It also misses an opportunity to provide valuable, albeit preliminary, information that can aid the physician's consultation. A third incorrect approach might involve the COMT speculating about treatment options or suggesting the patient seek a second opinion. This is a significant ethical and regulatory violation, as it encroaches on the physician's role in treatment planning and patient management, and could be construed as practicing medicine without a license. Professional reasoning. Professionals should approach such situations by first focusing on accurate data collection and observation as per their training. When explaining findings or potential anatomical correlates to a patient, the COMT must adhere strictly to their defined scope of practice. This involves explaining the normal function of an ocular structure and how a deviation from that normal function might relate to the observed symptom. The explanation should be factual, objective, and avoid diagnostic or prognostic statements. If a patient asks about diagnosis or treatment, the COMT should politely defer, stating that the physician will discuss these matters after a complete examination. Maintaining clear communication channels with the supervising physician is paramount, ensuring all patient interactions are consistent with the physician's plan of care. Question 7. The control framework reveals that when assessing a patient presenting with symptoms suggestive of age-related macular degeneration, AMD, a certified ophthalmic medical technologist, COMT, must employ a systematic approach to data acquisition and patient interaction. Which of the following approaches best aligns with the established professional and regulatory standards for COMT in this context? Option A. Immediately inform the patient about the likelihood of vision loss and discuss various treatment options, including experimental therapies, to manage their AMD proactively. Option B. Focus primarily on identifying and measuring the size and distribution of drusen on fundus examination, as this is the most critical diagnostic marker for AMD, and defer all patient education to the ophthalmologist. Option C. Thoroughly document the patient's visual acuity, visual fields, optical coherence tomography (OCT), findings and fundus photography, while also assessing the patient's understanding of their condition and providing clear, empathetic explanations of the diagnostic process and potential implications as guided by the ophthalmologist. Option D. Record the patient's visual acuity and note any subjective complaints of blurry vision. Then categorize the findings as typical age-related changes without further detailed investigation, unless specifically requested by the ophthalmologist. The correct answer is C. Thoroughly document the patient's visual acuity, visual fields, optical coherence tomography (OCT) findings, and fundus photography, while also assessing the patient's understanding of their condition and providing clear, empathetic explanations of the diagnostic process and potential implications as guided by the ophthalmologist. Explanation. The control framework reveals that a certified ophthalmic medical technologist, COMT, must adhere to established protocols and ethical guidelines when managing patient care, particularly in complex conditions like age-related macular degeneration, AMD. This scenario is professionally challenging because AMD presents with varying stages and visual impacts, requiring precise diagnostic interpretation and patient education tailored to individual needs. The COMT role is to accurately gather and document data that informs the ophthalmologist's diagnosis and treatment plan, while also ensuring the patient understands their condition and management options. The correct approach represents best professional practice because it prioritizes accurate, comprehensive data collection and clear, patient-centered communication, aligning with the COMT scope of practice and ethical obligations. This includes utilizing appropriate diagnostic tools, documenting findings meticulously, and providing understandable explanations of the condition and its implications, all within the regulatory framework governing ophthalmic medical technology. This ensures the ophthalmologist has the necessary information for informed decision-making and that the patient is empowered to participate in their care. An incorrect approach that focuses solely on documenting the presence of drusen without assessing visual function or patient understanding fails to meet the comprehensive requirements of patient assessment. This represents a regulatory failure by not adhering to the standard of care for AMD evaluation, which necessitates a multifaceted approach beyond simple morphological findings. Ethically, it neglects the patient's right to understand their condition and its impact on their vision. Another incorrect approach that involves providing definitive prognoses or treatment recommendations without the direct supervision and explicit instruction of the ophthalmologist is a significant ethical and regulatory violation. COMT operate under the direction of an ophthalmologist and are not licensed to provide medical diagnoses or prescribe treatments. This overreach undermines the physician-patient relationship and exposes both the technologist and the practice to liability. A further incorrect approach that dismisses patient concerns about visual changes as typical aging processes without thorough investigation is professionally unacceptable. This demonstrates a failure to adhere to the ethical principle of beneficence and non-maleficence, potentially delaying crucial diagnosis and intervention. It also fails to meet the regulatory expectation of thorough patient assessment and documentation. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly review the patient's history and chief complaint. Second, execute diagnostic tests according to established protocols, ensuring accuracy and completeness. Third, meticulously document all findings, including objective measurements and subjective patient reports. Fourth, communicate findings clearly and concisely to the supervising ophthalmologist. Fifth, if appropriate and within scope, provide patient education as directed by the ophthalmologist, ensuring the information is understandable and addresses the patient's concerns. Finally, always operate within the defined scope of practice and regulatory guidelines. Question 8. Cost-benefit analysis shows that investing in advanced visual field analysis software can improve diagnostic efficiency, but the certified ophthalmic medical technologist, COMT, must ensure that the software's interpretation of optic nerve head damage is critically evaluated. Which of the following actions best demonstrates adherence to regulatory compliance and professional best practice when interpreting a visual field test that suggests early glaucomatous changes in the optic nerve? Option A. Performing the visual field test using a different, less sophisticated machine to cross-reference the results, even if the initial test was performed correctly and the results appear consistent. Option B. Immediately reporting the software's findings of optic nerve damage to the patient without first consulting the supervising ophthalmologist, assuming the software's output is definitive. Option C. Thoroughly reviewing the raw visual field data, assessing for fixation errors, lid artifacts, and other potential sources of unreliability, and correlating any suspected defects with the ophthalmologist's objective findings of the optic nerve head and retinal nerve fiber layer. Option D. Relying solely on the software's automated report to flag potential glaucomatous defects, without independent verification of the visual field data quality or correlation with optic nerve head morphology. The correct answer is D. Relying solely on the software's automated report to flag potential glaucomatous defects without independent verification of the visual field data quality or correlation with optic nerve head morphology. Explanation. This scenario presents a professional challenge because the technologist must interpret subtle visual field findings that could indicate early optic nerve damage, a critical component of vision. The challenge lies in distinguishing between artifacts, normal variations, and genuine pathological changes, which requires a thorough understanding of both the technology used and the underlying ocular anatomy and physiology. Accurate interpretation is paramount for timely diagnosis and intervention, directly impacting patient prognosis and quality of life. Adhering to regulatory frameworks, such as those governing ophthalmic diagnostic procedures and patient care standards, is essential to ensure the reliability and validity of the findings. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic accuracy by meticulously reviewing the visual field data in conjunction with other relevant clinical information. This aligns with the COMT responsibility to perform and record diagnostic tests accurately and to recognize findings that warrant further investigation by the ophthalmologist. Regulatory guidelines for COMT emphasize the importance of precise data collection, artifact identification, and the ability to recognize and report significant clinical findings. This systematic approach ensures that the ophthalmologist receives comprehensive and reliable information for diagnosis and treatment planning, fulfilling the technologist's role within the scope of practice. An incorrect approach that relies solely on automated software interpretation, without critical human review, fails to meet professional standards. This is a regulatory failure because it bypasses the technologist's essential role in quality control and clinical judgment, potentially leading to misdiagnoses or false positives. Ethically, it compromises patient care by not ensuring the accuracy and completeness of diagnostic data. Another incorrect approach, which involves reporting findings without considering the patient's history or other clinical signs, is also a regulatory and ethical lapse. It demonstrates a lack of comprehensive patient assessment, which is a core competency for ophthalmic medical technologists. This can lead to misinterpretations and inappropriate clinical decisions. Furthermore, failing to document the methodology used for artifact identification or the rationale for excluding certain data points constitutes a failure to adhere to record-keeping standards, which are often mandated by regulatory bodies to ensure accountability and traceability of diagnostic processes. The professional decision-making process for similar situations involves a structured approach. First, thoroughly understand the patient's presenting complaint and medical history. Second, meticulously perform the diagnostic test, paying close attention to proper calibration, patient fixation, and any potential sources of error or artifact. Third, critically analyze the raw data, comparing it with normative data and considering potential confounding factors. Fourth, integrate the visual field findings with other available clinical information, such as intraocular pressure, optic nerve appearance, and fundus photography. Finally, accurately document all findings, including any limitations or uncertainties, and communicate them clearly to the supervising ophthalmologist. This systematic process ensures that diagnostic information is both accurate and clinically relevant, upholding the highest standards of patient care and regulatory compliance. Question 9. Risk assessment procedures indicate a patient with advanced glaucoma presence with significant visual field loss and subjective difficulties in navigating their environment, particularly in low light conditions. Which of the following approaches best reflects a comprehensive evaluation for this patient? Option A. Conducting only routine visual acuity and intraocular pressure measurements, assuming that these are sufficient indicators of the patient's functional visual status. Option B. focusing exclusively on objective measures of optic nerve damage and visual field defects, without assessing how these findings impact the patient's daily activities or their ability to perform tasks in various lighting conditions. Option C. Forming a detailed functional vision assessment, including tasks relevant to daily living and low-light performance, in conjunction with serial visual field testing and optic nerve head evaluation to monitor disease progression and correlate objective findings with functional deficits. Option D. Relying solely on the patient's subjective report of visual difficulties to determine the extent of their impairment and recommend interventions. Correct answer is C. Performing a detailed functional vision assessment, including tasks relevant to daily living and low-light performance, in conjunction with serial visual field testing and optic nerve head evaluation to monitor disease progression and correlate objective findings with functional deficits. Explanation. The scenario presents a common challenge in ophthalmic practice, managing a patient with a chronic, progressive ocular disease where visual function is significantly impacted. The professional challenge lies in balancing the need for accurate, objective assessment of disease progression with the patient's subjective experience of visual impairment and their functional limitations. Careful judgment is required to ensure that the chosen assessment methods are not only technically sound, but also clinically relevant and directly inform management decisions. The correct approach represents best professional practice because it prioritizes a comprehensive evaluation that directly correlates objective findings with the patient's functional status. This aligns with the ethical imperative to provide patient-centered care and to ensure that diagnostic and management strategies are tailored to the individual's needs and the impact of their condition on their daily life. Specifically, it adheres to guidelines that emphasize the importance of functional vision assessment in guiding treatment and rehabilitation for patients with low vision, ensuring that interventions are meaningful and improve quality of life. This approach is supported by the principle of beneficence, aiming to maximize the patient's well-being and functional independence. An incorrect approach that relies solely on objective measurements, without considering functional impact, fails to capture the full picture of the patient's visual impairment. This can lead to underestimation of the patient's needs and potentially inappropriate management plans. Ethically, this could be seen as a failure to adequately assess the patient's condition and its impact, potentially violating the principle of non-maleficence if the patient's functional needs are not addressed. Another incorrect approach that focuses only on subjective patient complaints without objective corroboration risks misdiagnosis or overestimation of the visual deficit. This can lead to unnecessary interventions or anxiety for the patient. From a regulatory and ethical standpoint, this approach lacks the rigor required for accurate medical assessment and could lead to inefficient use of healthcare resources. A further incorrect approach that prioritizes a single, isolated objective test without considering the broader clinical context or functional implications can lead to a narrow and potentially misleading understanding of the patient's visual status. This may not adequately inform treatment decisions and could result in a failure to identify all contributing factors to the patient's visual impairment. The professional decision-making process for similar situations should involve a systematic evaluation that begins with understanding the patient's chief complaint and history. This should be followed by a thorough objective examination, including appropriate diagnostic tests relevant to the suspected condition. Crucially, the findings from the objective examination must be interpreted in the context of the patient's reported functional limitations and visual needs. This integrated approach ensures that the assessment is comprehensive, accurate, and directly informs a personalized and effective management plan, adhering to professional standards of care and ethical obligations. Question 10. Assessment of a patient presenting with significant ocular discomfort and blurred vision, where initial diagnostic imaging and visual acuity testing reveal no objective abnormalities, requires a systematic approach to determine the underlying cause and appropriate management. Which of the following represents the most appropriate next step for the certified ophthalmic medical technologist, COMT? Option A. Prescribe over-the-counter lubricating eye drops and advise the patient to monitor symptoms, assuming the discomfort is transient. Option B. Immediately refer the patient to a neuro-ophthalmologist without further investigation or discussion with the supervising ophthalmologist. Option C. Document the lack of objective findings and inform the patient that their symptoms are likely psychosomatic and require no further ophthalmic intervention. Option D. Reevaluate the patient's subjective complaints and perform a more detailed objective examination, considering potential subtle findings or alternative diagnostic modalities, and consult with the supervising ophthalmologist regarding the discrepancy. The correct answer is D. Reevaluate the patient's subjective complaints and perform a more detailed objective examination, considering potential subtle findings or alternative diagnostic modalities, and consult with the supervising ophthalmologist regarding the discrepancy. Explanation. Scenario analysis. This scenario presents a common challenge in ophthalmic practice where a patient's subjective symptoms do not immediately align with objective clinical findings. The COMT must exercise critical judgment to reconcile these discrepancies, ensuring patient safety and appropriate management without over- or undertreating. The challenge lies in interpreting subtle signs, considering potential underlying conditions, and knowing when to escalate care. Correct approach analysis. The correct approach prioritizes a thorough reevaluation and consideration of differential diagnoses. This aligns with the COMT role as a skilled technician and patient advocate, emphasizing a systematic and evidence-based approach to diagnosis and management. It reflects best professional practice by ensuring that all reasonable explanations for the patient's symptoms are explored before settling on a treatment plan. This adheres to the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, by not prematurely dismissing symptoms or initiating inappropriate interventions. Regulatory frameworks for ophthalmic technologists emphasize accurate data collection, critical analysis of findings, and appropriate communication with the supervising physician, all of which are encompassed by this approach. Incorrect approaches analysis. One incorrect approach involves immediately initiating treatment based solely on the patient's reported symptoms, despite contradictory objective findings. This fails to uphold the principle of evidence-based practice and risks inappropriate treatment, potentially causing harm or masking a more serious underlying condition. It also demonstrates a failure to critically analyze all available data, a core competency for a COMT. Ethically, this could be considered a breach of non-maleficence. Another incorrect approach is to dismiss the patient's symptoms entirely because they do not correlate with initial objective findings. This disregards the patient's subjective experience and can lead to patient dissatisfaction and a breakdown in the patient-provider relationship. It also fails to consider that initial findings might be incomplete or that the patient's symptoms may be indicative of a condition not immediately apparent. This approach can violate the ethical principle of respect for persons and patient autonomy. A third incorrect approach is to immediately refer the patient to a specialist without further investigation or consultation with the supervising physician. While referral is sometimes necessary, it should be a considered decision based on a comprehensive assessment. Premature referral can lead to unnecessary costs and delays in care, and it bypasses the COMT and supervising physician's responsibility to conduct an initial diagnostic workup. This can be seen as a failure to utilize resources effectively and to fulfill professional responsibilities. Professional reasoning. Professionals should employ a decision-making framework that begins with a comprehensive review of all gathered data, including patient history, subjective complaints, and objective findings. When discrepancies arise, the next step is to systematically reevaluate the objective findings, considering potential sources of error or subtle signs that may have been missed. This should be followed by a thorough consideration of differential diagnoses that could explain both the symptoms and the findings. Consultation with the supervising physician is crucial at this stage to discuss the discrepancies and formulate a plan for further investigation or management. This iterative process of data collection, analysis, hypothesis generation, and consultation ensures that patient care is both safe and effective. Question 11. Comparative studies suggest that a patient presenting with sudden onset of new floaters, flashes of light in their peripheral vision, and a described sensation of a dark curtain moving across their visual field without any history of trauma is most concerning for which of the following potential conditions requiring immediate ophthalmic evaluation? Option A. Acute angle closure glaucoma. Option B. Anterior uveitis. Option C. Migraine with aura. Option D. Posterior vitreous detachment with a retinal tear or detachment. The correct answer is D. Posterior vitreous detachment with a retinal tear or detachment. Explanation. Scenario analysis. This scenario presents a common challenge in ophthalmic practice, where a patient exhibits symptoms that could be indicative of multiple conditions, some of which are sight-threatening. The technologist must accurately identify the most probable cause based on the presented signs and symptoms, while also considering the patient's history and risk factors. The challenge lies in differentiating between common, benign conditions and more serious pathologies that require immediate referral and intervention. This requires a thorough understanding of the differential diagnosis for the observed signs and symptoms, as well as the ability to prioritize patient care based on the potential for vision loss. Correct approach analysis. The correct approach involves a systematic evaluation that prioritizes the most serious potential diagnoses, recognizing the constellation of symptoms, sudden onset of floaters, flashes of light, and a curtain-like shadow, as highly suggestive of a posterior vitreous detachment with potential retinal tear or detachment, is paramount. This approach aligns with best professional practice by immediately considering the most urgent differential diagnosis. The COMT role is to gather comprehensive data, identify potential red flags, and communicate these findings to the supervising ophthalmologist for prompt evaluation and management. This proactive stance ensures timely intervention, which is critical for preserving vision in cases of retinal detachment. Adherence to established clinical protocols and ethical obligations to patient welfare dictates this prioritized approach. Incorrect approach is analysis. One incorrect approach would be to dismiss the symptoms as age-related changes without further investigation. This fails to acknowledge the potential for a retinal tear or detachment, which is a sight-threatening emergency. Ethically, this constitutes a failure to provide appropriate care and a breach of the duty of diligence. From a regulatory standpoint, it could be considered negligence. Another incorrect approach would be to focus solely on less urgent differentials, such as a simple posterior vitreous detachment, without considering the possibility of a concomitant retinal tear or detachment. While a PVD itself is common, the associated symptoms described necessitate a higher level of suspicion for complications. This approach risks delaying critical diagnostic and therapeutic interventions. A third incorrect approach would be to provide a definitive diagnosis without the direct supervision and confirmation of the ophthalmologist. The COMT role is to collect data and identify potential issues, not to make final diagnoses or treatment plans. Overstepping professional boundaries in this manner is a regulatory and ethical violation, potentially leading to misdiagnosis and inappropriate management. Professional reasoning. When faced with a patient presenting with new-onset floaters, flashes, and a visual field defect, the professional decision-making process should involve 1. Recognizing the urgency of the symptoms. 2. Prioritizing the most serious potential diagnoses, e.g., retinal tear, retinal detachment. 3. Performing a thorough ophthalmic examination to gather all relevant clinical data. 4. Documenting all findings meticulously. 5. Communicating the findings and concerns promptly and clearly to the supervising ophthalmologist. 6. Following the ophthalmologist's instructions for further management. This systematic approach ensures patient safety and adherence to professional standards of care. Question 12. The monitoring system demonstrates a sustained, mild elevation in intraocular pressure (IOP) and a slight narrowing of the anterior chamber angle in the right eye, with no significant changes noted in the left eye. Considering the potential for both open-angle and angle-closure glaucoma, which of the following diagnostic considerations best reflects a comprehensive and clinically appropriate approach for the certified ophthalmic medical technologist, COMT, to report to the ophthalmologist? Option A. Focus the report solely on the IOP elevation, as this is the primary indicator of glaucoma, and defer further angle assessment to the ophthalmologist's discretion. Option B. Report the findings as indicative of early open-angle glaucoma due to the mild IOP elevation, noting the angle narrowing as a secondary observation. Option C. Conclude that the findings are within normal variation for this patient and do not warrant further investigation at this time. Option D. Recommend immediate gonioscopy and a dilated fundus examination to further assess the anterior chamber angle and optic nerve head for signs consistent with either open-angle or angle-closure glaucoma. The correct answer is B. Report the findings as indicative of early open-angle glaucoma due to the mild IOP elevation, noting the angle narrowing as a secondary observation. Explanation. Scenario analysis. This scenario presents a professional challenge because the monitoring system's findings, while suggestive, are not definitive. The technologist must interpret subtle changes in ocular parameters and correlate them with known disease mechanisms for both open-angle and angle-closure glaucoma. Misinterpreting these findings could lead to delayed or incorrect diagnosis and treatment, impacting patient outcomes. The challenge lies in distinguishing between the gradual, progressive nature of open-angle glaucoma and the potentially acute, vision-threatening nature of angle-closure glaucoma based on dynamic changes. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates the monitoring system's data with the patient's clinical presentation and history. This aligns with the COMT role in gathering and interpreting diagnostic information to support the ophthalmologist's diagnosis. Best professional practice dictates a thorough evaluation, considering all available data points. This approach ensures that the technologist is not solely reliant on automated system outputs, but applies their knowledge of ophthalmic pathology and diagnostic techniques to provide a nuanced and accurate report. This adheres to the ethical obligation of providing competent patient care and the regulatory expectation of accurate data collection and preliminary interpretation within the scope of practice. Incorrect approaches analysis, focusing solely on the increased intraocular pressure, IOP, without considering other parameters, such as anterior chamber angle status or optic nerve appearance, is an incomplete assessment. This could lead to misdiagnosis, as elevated IOP can occur in various conditions, not exclusively glaucoma, or it might miss the critical angle dynamics of angle-closure glaucoma. This approach fails to meet the standard of care by not performing a comprehensive evaluation. Attributing the findings definitively to open-angle glaucoma based on a single parameter like IOP, without further investigation into the angle, is premature. Open-angle glaucoma is characterized by a wide anterior chamber angle, and while IOP is a key factor, the angle's appearance is crucial for differentiation. This approach risks overlooking the possibility of angle-closure glaucoma, which requires immediate intervention. This constitutes a failure in diagnostic diligence. Dismissing the findings as insignificant because the IOP is only mildly elevated ignores the potential for progressive damage. Even mild elevations, especially if sustained or associated with other risk factors, can be indicative of early-stage glaucoma. This approach neglects the principle of early detection and intervention, which is paramount in managing chronic conditions like glaucoma. This represents a failure to act on potentially critical diagnostic information. Professional reasoning. Professionals should approach such situations by first understanding the limitations of the monitoring system and recognizing that it provides data, not a diagnosis. The decision-making process should involve 1. Reviewing all data from the monitoring system, noting trends and specific values. 2. Correlating these findings with the patient's subjective complaints and objective clinical signs. 3. Considering the differential diagnosis for the observed parameters, specifically differentiating between open-angle and angle-closure glaucoma based on the full spectrum of available information, e.g., gonioscopy findings, optic nerve appearance, visual field defects. 4. Documenting all findings and interpretations clearly and concisely for the ophthalmologist. 5. Communicating any urgent or concerning findings promptly. This systematic approach ensures comprehensive patient care and adherence to professional standards. Question 13. To address the challenge of a patient presenting with a red, irritated conjunctiva and a sensation of a foreign body, what is the most appropriate course of action for a certified ophthalmic medical technologist, COMT, operating under U.S. regulatory guidelines? Option A. Immediately apply topical anesthetic and attempt to remove any perceived foreign body without a full examination. Option B. Perform a detailed slit lamp examination. Document all findings including any discharge, injection patterns, or visible foreign material, and prepare a concise summary for the supervising ophthalmologist. Option C. Advise the patient to use artificial tears and monitor symptoms for 24 hours before seeking further medical attention. Option D. Focus solely on the patient's description of a foreign body sensation and document only that symptom. Correct answer is B. Perform a detailed slit lamp examination. Document all findings including any discharge, injection patterns, or visible foreign material, and prepare a concise summary for the supervising ophthalmologist. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misdiagnosis and inappropriate treatment based on subtle conjunctival findings. The technologist must accurately differentiate between a benign inflammatory process and a more serious condition that could impact vision or require systemic intervention. This requires a thorough understanding of conjunctival anatomy, common pathologies, and the appropriate diagnostic steps within the COMT scope of practice, adhering strictly to U.S. regulatory frameworks governing ophthalmic medical personnel. Correct approach analysis. The correct approach involves a systematic and evidence-based methodology. It prioritizes gathering comprehensive patient history, performing a detailed slit lamp examination with appropriate magnification and illumination, and documenting all findings meticulously. This aligns with the COMT role in assisting the ophthalmologist by providing accurate and relevant clinical data. The use of diagnostic stains like fluorescein or lissamine green, if indicated and within the technologist's defined scope, further aids in identifying subtle epithelial defects or foreign bodies, which are crucial for diagnosis. This approach ensures that the ophthalmologist receives the most complete and accurate information for definitive diagnosis and treatment planning, upholding the standard of care expected under U.S. healthcare regulations. Incorrect approaches analysis. One incorrect approach involves making a presumptive diagnosis and recommending over-the-counter treatments without consulting the ophthalmologist. This violates the principle of professional accountability and exceeds the technologist's scope of practice, potentially leading to delayed or incorrect treatment, which is a regulatory failure. Another incorrect approach is to dismiss subtle findings as insignificant without further investigation or documentation. This can lead to misdiagnoses of serious conditions, a failure to meet the standard of care, and potential harm to the patient, representing a breach of ethical and regulatory obligations. A third incorrect approach is to rely solely on patient self-reporting of symptoms without objective clinical examination. While patient history is vital, it must be corroborated by objective findings. Failure to perform a thorough examination can result in incomplete or inaccurate data being presented to the ophthalmologist, which is a failure in professional duty. Professional reasoning. Professionals should adopt a systematic approach. 1. Patient assessment. Obtain a thorough history and chief complaint. 2. Clinical examination. Conduct a comprehensive slit lamp examination, utilizing appropriate techniques and diagnostic aids. 3. Documentation. Meticulously record all findings including size, location, color, and any associated signs. 4. Communication. Clearly and concisely report findings to the supervising ophthalmologist. 5. Adherence to scope. Ensure all actions are within the defined scope of practice for an ophthalmic medical technologist as per U.S. regulations. This structured decision-making process minimizes errors and ensures patient safety and optimal care. Question 14. Process analysis reveals that a COMT is evaluating a patient with a known history of type 2 diabetes mellitus. The patient presents for a routine eye examination. The COMT has obtained visual acuity, performed a dilated fundus examination, and reviewed optical coherence tomography (OCT) scans. The fundus examination reveals moderate non-proliferative diabetic retinopathy (NPDR) in both eyes, with no evidence of neovascularization. The OCT scans show mild macular edema in the left eye. The patient reports generally good adherence to their oral diabetes medications, but admits to occasional missed appointments with their primary care physician for a 1C monitoring. Given this information, which of the following approaches best represents a comprehensive risk assessment for diabetic retinopathy progression? Option A. Stratifying the patient's risk based on the current grade of NPDR and the presence of macular edema, while also considering the reported adherence to diabetes medication and the implications of inconsistent A1C monitoring for future disease management. Option B. Focusing exclusively on the OCT findings of mild macular edema as the primary indicator of immediate risk, without further consideration of the patient's overall diabetic control or history. Option C. Recommending immediate panretinal photocoagulation due to the presence of macular edema, irrespective of the current NPDR grade or the patient's overall diabetic control. Option D. Assigning a low risk of progression solely because there is no neovascularization present, despite the presence of macular edema and inconsistent primary care follow-up. The correct answer is A. stratifying the patient's risk based on the current grade of NPDR and the presence of macular edema, while also considering the reported adherence to diabetes medication and the implications of inconsistent A1C monitoring for future disease management. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the COMT to synthesize information from multiple sources, patient history, clinical findings, diagnostic imaging, to accurately assess the risk of diabetic retinopathy progression. The COMT must not only identify the presence of DR, but also stratify its severity and predict potential future complications, which directly impacts patient management and referral decisions. This necessitates a thorough understanding of established risk factors and their clinical significance within the context of the COMT scope of practice. Correct approach analysis. The correct approach involves a comprehensive risk assessment that integrates the patient's glycemic control, duration of diabetes, presence and severity of existing diabetic retinopathy, and the presence of other ocular or systemic comorbidities. This aligns with the principles of evidence-based practice and the guidelines set forth by professional organizations that inform COMT practice, emphasizing a proactive and individualized approach to patient care. By considering these multifaceted factors, the COMT can provide a more accurate and clinically relevant assessment, facilitating timely and appropriate interventions by the ophthalmologist. This approach prioritizes patient safety and optimal outcomes by identifying those at highest risk for vision-threatening complications. Incorrect approaches analysis. One incorrect approach would be to solely focus on the current grade of diabetic retinopathy without considering the patient's overall diabetic control or history. This is a failure to adhere to best practices because it ignores critical contributing factors to DR progression, potentially leading to an underestimation of risk and delayed intervention. Ethically, it represents a lapse in due diligence by not performing a complete risk assessment. Another incorrect approach would be to rely exclusively on the patient's self-reported adherence to treatment without objective verification or further investigation. This is problematic as patient recall can be unreliable, and a failure to independently assess adherence can lead to misjudging the effectiveness of management strategies and the patient's true risk. This approach risks compromising patient care by not fully understanding the factors influencing disease progression. A third incorrect approach would be to dismiss the significance of mild non-proliferative diabetic retinopathy, NPDR, in a patient with poorly controlled diabetes and a long history of the disease. This overlooks the dynamic nature of DR and the potential for rapid progression, even from seemingly mild stages, especially when underlying risk factors are not adequately managed. This failure to recognize the cumulative impact of risk factors is a significant professional and ethical oversight. Professional reasoning. Professionals should approach risk assessment for diabetic retinopathy by first gathering all available patient data, including medical history, current medications, and previous ocular findings. They should then systematically evaluate each identified risk factor, considering its individual contribution and its interaction with other factors. This involves consulting current clinical guidelines and best practice recommendations relevant to their scope of practice. The COMT should then synthesize this information to formulate a comprehensive risk profile, which is then communicated to the supervising ophthalmologist to guide further management decisions. This systematic, evidence-based, and collaborative approach ensures that patient care is optimized and potential complications are proactively addressed. Question 15. Operational review demonstrates that a certified ophthalmic medical technologist, COMT, has completed a comprehensive dilated fundus examination on a patient presenting with sudden onset of floaters and flashes of light. The COMT observed what appeared to be a subtle, wavy undulation of the neurosensory retina in the superior periphery, with a few small pigment epithelial detachments noted inferiorly. The COMT also noted a small vitreous hemorrhage. Which of the following actions best represents the COMT professional responsibility in this situation? Option A. Inform the patient that they likely have a retinal detachment and advise them to go to the emergency room immediately. Option B. Perform additional imaging, such as optical coherence tomography, OCT, of the superior periphery, without consulting the ophthalmologist to confirm the presence of retinal detachment. Option C. Document all findings accurately in the patient's chart and immediately notify the supervising ophthalmologist of the observations, including the subtle retinal undulation, pigment epithelial detachments, and vitreous hemorrhage. Option D. Reassure the patient that these symptoms are common and often resolve on their own, and simply document the findings for the next routine follow-up. The correct answer is A. Inform the patient that they likely have a retinal detachment and advise them to go to the emergency room immediately. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of retinal detachment diagnosis and management. The COMT role is to accurately gather diagnostic data, but the interpretation and subsequent patient management decisions lie with the ophthalmologist. The challenge lies in ensuring the COMT actions do not overstep their scope of practice, while still providing comprehensive and timely information to facilitate optimal patient care. Misinterpreting findings or delaying reporting can have severe consequences for the patient's vision. Correct approach analysis. The correct approach involves meticulously documenting all observed findings, including any signs suggestive of retinal detachment, and promptly communicating these findings to the supervising ophthalmologist. This adheres to the COMT scope of practice, which focuses on data acquisition and preliminary observation, not definitive diagnosis or treatment planning. This approach ensures that the ophthalmologist receives accurate and complete information in a timely manner, allowing for prompt diagnostic confirmation and appropriate management, thereby upholding the ethical obligation to patient welfare and adhering to professional standards of care within the COMT-defined responsibilities. Incorrect approaches analysis. One incorrect approach would be to make a definitive diagnosis of retinal detachment and inform the patient directly. This is a regulatory and ethical failure because it exceeds the COMT scope of practice. Diagnosis and patient communication are the responsibility of the licensed ophthalmologist. This action could lead to patient anxiety, misinformation, and potentially interfere with the ophthalmologist's established diagnostic and communication protocols. Another incorrect approach would be to only document the findings without immediate notification to the ophthalmologist, especially if the findings are highly suggestive of a serious condition like retinal detachment. This represents a failure in professional responsibility and potentially violates guidelines regarding timely reporting of critical findings. Delaying communication can lead to a delay in diagnosis and treatment, negatively impacting the patient's prognosis and visual outcome, and could be considered a breach of the duty of care. A third incorrect approach would be to dismiss subtle but potentially significant findings as insignificant without further investigation or reporting. While the COMT is not expected to diagnose, they are expected to recognize and report abnormalities. Ignoring or downplaying findings that could indicate an early retinal detachment, even if not overtly obvious, is a failure to exercise due diligence and could lead to a missed or delayed diagnosis, with serious consequences for the patient. Professional reasoning. Professionals in this role should employ a systematic decision-making process. First, accurately perform all ordered diagnostic tests and procedures. Second, meticulously document all objective findings, noting any deviations from normal. Third, critically assess the findings for any indicators of serious pathology, such as those suggestive of retinal detachment. Fourth, immediately communicate any concerning findings to the supervising ophthalmologist, providing a clear and concise summary of observations. Finally, await further instructions from the ophthalmologist regarding patient management and communication. This process ensures adherence to scope of practice, upholds ethical obligations, and prioritizes patient safety and optimal outcomes. Question 16. The performance metrics show a persistent increase in patient-reported discomfort and reduced visual acuity in individuals undergoing treatment for moderate to severe dry eye disease over the past 6 months. Considering the established treatment algorithms for this condition, which of the following actions is the most appropriate next step for the certified ophthalmic medical technologist, COMT? Option A. Document the increased patient-reported discomfort and reduced visual acuity as expected side effects of the current treatment and continue with the existing protocol without further investigation. Option B. Advise patients in this cohort to independently adjust their medication dosages based on their subjective symptom experience to find a more comfortable regimen. Option C. Suggest to patients that their symptoms are likely due to factors unrelated to their dry eye treatment and encourage them to seek general medical advice. Option D. Initiate a detailed review of the treatment protocols and medications currently being administered to this patient cohort. comparing them against current evidence-based guidelines, and recommending a discussion with the supervising ophthalmologist regarding potential adjustments. The correct answer is D. Initiate a detailed review of the treatment protocols and medications currently being administered to this patient cohort, comparing them against current evidence-based guidelines, and recommending a discussion with the supervising ophthalmologist regarding potential adjustments. Explanation: the performance metrics show a consistent trend of suboptimal patient outcomes in a specific cohort undergoing treatment for dry eye disease. This scenario is professionally challenging because it requires the COMT to move beyond routine data collection and actively engage in the interpretation of clinical data to identify potential areas for improvement in patient care. The COMT must consider the established treatment protocols and guidelines for dry eye disease, as defined by relevant U.S. regulatory bodies and professional ophthalmic organizations, to ensure patient safety and efficacy. The correct approach involves a systematic review of the treatment options utilized for this patient cohort, comparing them against current evidence-based guidelines and best practices. This includes evaluating the appropriateness of prescribed medications, the adherence to treatment regimens, and the effectiveness of non-pharmacological interventions. The COMT role is to identify deviations from standard care or emerging trends that may be contributing to the poor performance metrics. This proactive identification of issues, followed by a recommendation for a review of treatment protocols by the supervising ophthalmologist, represents best professional practice. It aligns with the COMT responsibility to contribute to quality improvement initiatives and ensure that patient care adheres to established standards of practice, as implicitly supported by regulations promoting patient safety and quality of care in the U.S. healthcare system. An incorrect approach would be to dismiss the performance metrics as statistical anomalies without further investigation. This fails to acknowledge the COMT role in identifying potential systemic issues affecting patient care and could lead to continued suboptimal outcomes, potentially violating ethical obligations to advocate for patient well-being. Another incorrect approach is to unilaterally alter treatment plans based on personal interpretation of the data, without consulting the supervising ophthalmologist. This oversteps the COMT scope of practice and could lead to inappropriate or harmful interventions, directly contravening established professional boundaries and regulatory frameworks governing medical practice. Finally, focusing solely on patient compliance without investigating the efficacy or appropriateness of the prescribed treatments ignores a critical component of treatment success and fails to address potential issues with the treatment plan itself. Professionals should employ a decision-making framework that begins with objective data analysis. When performance metrics indicate a problem, the next step is to consult relevant clinical guidelines and evidence-based literature. This is followed by a collaborative discussion with the supervising physician to interpret the findings and formulate a plan. The COMT expertise in data collection and understanding of ophthalmic procedures and treatments is crucial in this process, enabling them to provide valuable insights that contribute to informed clinical decisions and ultimately improve patient care. Question 17. Consider a scenario where a patient presents with a sudden onset of blurry vision in one eye, accompanied by intermittent flashes of light. The patient also reports a mild, dull ache behind the eye. As a certified ophthalmic medical technologist, COMT, what is the most appropriate course of action to ensure accurate diagnosis and patient care, adhering strictly to U.S. regulatory frameworks and COMT certification guidelines? Option A. Form a comprehensive ophthalmic examination, including visual acuity, pupillary assessment, slit lamp examination, gonioscopy, dilated fundus examination, and optical coherence tomography, OCT, of the macula and optic nerve, documenting all findings meticulously for the ophthalmologist. Option B. Focus solely on the reported ache behind the eye, prescribing a mild analgesic and scheduling a follow-up appointment in 2 weeks. Option C. Advise the patient that the symptoms are likely due to eye strain and recommend over-the-counter eye drops, suggesting they return if symptoms worsen. Option D. Immediately inform the patient that they are experiencing symptoms consistent with a retinal detachment and instruct them to go to the emergency room. Correct answer is A. Perform a comprehensive ophthalmic examination, including visual acuity, pupillary assessment, slit lamp examination, gonioscopy, dilated fundus examination, and optical coherence tomography, OCT, of the macula and optic nerve, documenting all findings meticulously for the ophthalmologist. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpreting subtle symptoms, which can lead to delayed or incorrect diagnosis. The technologist must rely on their comprehensive understanding of ophthalmic conditions and their ability to accurately document and communicate findings to the supervising ophthalmologist. The challenge lies in distinguishing between common, benign symptoms and those indicative of a more serious underlying pathology, requiring a high degree of clinical acumen and adherence to established diagnostic protocols. Correct approach analysis. The correct approach involves a systematic and thorough evaluation of the patient's reported symptoms, correlating them with objective clinical findings obtained during the examination. This aligns with the COMT role in assisting the ophthalmologist by gathering and documenting relevant patient information and preliminary diagnostic data. Adherence to established diagnostic guidelines and protocols, as typically outlined in COMT training and certification materials, ensures that all necessary steps are taken to accurately assess the patient's condition. This methodical process minimizes the risk of overlooking critical signs and facilitates an accurate diagnosis by the ophthalmologist. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's symptoms as minor without a comprehensive examination, potentially leading to a misdiagnosis of a serious condition. This violates the ethical obligation to provide thorough patient care and the regulatory expectation that ophthalmic medical technologists perform their duties with diligence and competence. Another incorrect approach would be to prematurely offer a diagnosis to the patient. The COMT scope of practice is to gather data and assist the ophthalmologist. Diagnosing is the responsibility of the licensed physician. Providing a diagnosis would exceed the technologist's authority and could lead to patient anxiety or inappropriate self-treatment, representing a significant regulatory and ethical breach. A further incorrect approach would be to rely solely on the patient's subjective report without performing objective clinical tests. While patient history is crucial, objective findings are essential for confirming or refuting suspected diagnoses. Failing to conduct appropriate tests would be a failure to meet the standard of care expected of a certified ophthalmic medical technologist. Professional reasoning. Professionals should approach such situations by first actively listening to and documenting the patient's chief complaint and associated symptoms. This should be followed by a systematic, protocol-driven ophthalmic examination, including relevant diagnostic tests based on the presenting symptoms. All findings, both subjective and objective, must be meticulously recorded. Finally, the technologist must communicate these findings clearly and concisely to the supervising ophthalmologist, enabling them to make an informed diagnosis and treatment plan. This decision-making process prioritizes patient safety, diagnostic accuracy, and adherence to professional scope of practice. Question 18. The investigation demonstrates a patient presenting with epiphora and discomfort 3 days post-nasolacrimal duct probing. The ophthalmologist suspects a residual foreign body or early obstruction. As a certified ophthalmic medical technologist, COMT, what is the most appropriate initial approach to assess the patency and integrity of the lacrimal drainage system? Option A. Irrigate the lacrimal system using tap water to ensure thorough cleansing before further assessment. Option B. Rely solely on external observation of the eyelids and conjunctiva, deferring any internal assessment to the ophthalmologist. Option C. Perform sterile irrigation of the lacrimal system with sterile saline, observing for reflux and patency, and if indicated and within scope, gently attempt sterile lacrimal probing under direct visualization. Option D. Proceed directly to aggressive lacrimal probing with a standard lacrimal probe to dislodge any potential foreign body without prior irrigation. Correct answer is C. Perform sterile irrigation of the lacrimal system with sterile saline, observing for reflux and patency, and if indicated and within scope, gently attempt sterile lacrimal probing under direct visualization. Explanation. Scenario analysis. This scenario presents a challenge in managing a patient with a potentially compromised lacrimal system, where the risk of infection is elevated due to the presence of a foreign body and the subsequent surgical intervention. The technologist must balance the need for thorough examination with the imperative to minimize iatrogenic complications and adhere to strict infection control protocols. The complexity arises from the need to accurately assess the lacrimal drainage pathway's integrity and function, while mitigating the risk of introducing pathogens or exacerbating existing inflammation. Correct approach analysis. The correct approach involves a systematic and sterile assessment of the lacrimal system, prioritizing patient safety and diagnostic accuracy. This includes careful irrigation with sterile saline, observing for patency and reflux, and potentially utilizing a sterile lacrimal probe under direct visualization if indicated and within the technologist's scope of practice, as defined by COMT certification guidelines and state practice acts. This method ensures that the assessment is performed with minimal risk of introducing infection, accurately identifies any blockages or abnormalities, and provides essential data for the ophthalmologist's treatment plan. Adherence to sterile technique is paramount, directly aligning with COMT responsibility to maintain patient safety and prevent complications, as implicitly required by the ethical standards and scope of practice for certified ophthalmic medical personnel. Incorrect approaches analysis. One incorrect approach would be to proceed with irrigation using non-sterile solutions or equipment. This directly violates fundamental principles of infection control, increasing the risk of introducing bacteria into the lacrimal system, potentially leading to dacryocystitis or conjunctivitis. Such a failure represents a significant breach of professional responsibility and could be considered negligent. Another incorrect approach would be to skip the irrigation and probing steps altogether, relying solely on external observation. While observation is important, it is insufficient to assess the functional patency of the lacrimal drainage system, especially after a surgical procedure. This omission would lead to incomplete diagnostic information, potentially delaying appropriate treatment and failing to meet the standard of care expected of a COMT. A third incorrect approach would be to perform aggressive probing without adequate visualization or sterile precautions. This could cause trauma to the delicate lacrimal structures, leading to bleeding, pain, or further obstruction. It also increases the risk of infection if sterile technique is not meticulously maintained throughout the procedure. This demonstrates a lack of understanding of the delicate nature of the lacrimal system and a failure to adhere to safe patient care practices. Professional reasoning. When faced with a patient post-lacrimal surgery with a suspected foreign body, a COMT should first review the patient's chart and the operative report to understand the surgical procedure and any specific post-operative instructions. Next, they should communicate with the supervising ophthalmologist to clarify the diagnostic goals and any specific concerns. The assessment should then proceed using sterile techniques, starting with visual inspection and progressing to gentle irrigation. If further assessment is required, such as probing, it should only be performed if within the technologist's scope of practice and with appropriate sterile instrumentation and visualization. Throughout the process, meticulous documentation of findings and any interventions is crucial. Question 19. Upon reviewing the patient's chart for an upcoming optical coherence tomography (OCT) scan, the certified ophthalmic medical technologist (COMT) notices that the specific OCT unit scheduled for use has recently been flagged for intermittent calibration issues, potentially affecting the accuracy of its measurements, especially for subtle macular changes. The patient has a history of diabetic retinopathy with suspected progression. What is the most appropriate course of action for the COMT? Option A. Inform the supervising physician immediately about the calibration concerns with the OCT unit and request a different, properly calibrated unit or a rescheduled appointment to ensure diagnostic accuracy and patient safety. Option B. Proceed with the OCT scan using the flagged unit, documenting the potential calibration issue and advising the supervising physician to interpret the results with caution. Option C. Perform a less detailed imaging modality, such as a fundus photograph, as a substitute for the OCT to avoid potential inaccuracies. Option D. Attempt to recalibrate the OCT unit independently before the scan, based on general knowledge of OCT operation, to resolve the issue. The correct answer is B. Proceed with the OCT scan using the flagged unit, documenting the potential calibration issue, and advising the supervising physician to interpret the results with caution. Explanation. This scenario presents a common implementation challenge in ophthalmic diagnostics, ensuring the accurate and ethical application of advanced imaging technology in a busy clinical setting. The challenge lies in balancing the need for timely patient care with the meticulous requirements of a specific diagnostic procedure, particularly when faced with potential equipment limitations or patient factors. Careful judgment is required to determine the most appropriate course of action that upholds patient safety, diagnostic integrity, and regulatory compliance. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic accuracy by adhering to established protocols for the specific imaging modality. This involves recognizing the limitations of the current equipment and seeking a solution that ensures the integrity of the diagnostic data without compromising the patient's well-being or the reliability of the test. This aligns with the ethical obligation to provide competent care and the regulatory expectation to perform diagnostic procedures according to accepted standards, as outlined by professional bodies governing ophthalmic medical technology. An incorrect approach that proceeds with a suboptimal or potentially inaccurate test due to time constraints or equipment issues would represent a failure to uphold the standard of care. This could lead to misdiagnosis or delayed diagnosis, negatively impacting patient outcomes. Ethically, it violates the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. From a regulatory standpoint, it could be seen as a deviation from accepted practice guidelines, potentially leading to scrutiny by oversight bodies. Another incorrect approach, such as attempting a procedure for which the technologist is not adequately trained or for which the equipment is not calibrated, poses significant risks. This directly contravenes the principle of competence and could result in patient harm and invalid diagnostic results. It also violates regulatory requirements that mandate practitioners operate within their scope of practice and utilize properly functioning equipment. The professional decision-making process in such situations should involve a systematic evaluation of the clinical situation, available resources, and established protocols. This includes 1. Identifying the diagnostic objective and the required procedure. 2. Assessing the suitability of the available equipment and the technologist's proficiency. 3. Recognizing any deviations or limitations that might compromise the test's accuracy or safety. 4. Consulting with the supervising physician or senior technologist when uncertainty exists or when protocols cannot be met. 5. Prioritizing patient safety and diagnostic integrity above all else, even if it means rescheduling or modifying the approach in consultation with the physician. Question 20. Quality control measures reveal a pattern of inconsistent patient responses during subjective refraction, particularly when assessing the 20/20 line. The patient reports seeing the 20/20 line sort of clear with one lens combination, but then expresses uncertainty when asked to confirm if it's the best possible clarity. What is the most appropriate next step for the certified ophthalmic medical technologist, COMT, to ensure the most accurate subjective refraction? Option A. Accept the patient's initial statement of seeing the 20/20 line as sufficient and proceed to the next step of the refraction. Option B. Reevaluate the 20/20 line using alternative phrasing and potentially reintroducing the previous lens combination to confirm the patient's preference, while also considering the next smaller line for comparison if definitive clarity cannot be achieved. Option C. Ask the patient if they are sure they can see the 20/20 line clearly and then move to the 20/25 line if they express any doubt. Option D. Assume the patient is satisfied with the current acuity and finalize the prescription based on the last clear response, even if there was subsequent uncertainty. The correct answer is B. Reevaluate the 20/20 line using alternative phrasing and potentially reintroducing the previous lens combination to confirm the patient's preference, while also considering the next smaller line for comparison if definitive clarity cannot be achieved. Explanation. This scenario presents a common challenge in subjective refraction where patient responses can be ambiguous or inconsistent, impacting the accuracy of the final prescription. The COMT role is to elicit the most reliable subjective data to optimize visual acuity and patient comfort, adhering to established clinical protocols and ethical standards of care. The difficulty lies in interpreting subjective feedback and making informed decisions without introducing bias or compromising the integrity of the refraction process. The correct approach prioritizes patient-centered care and objective verification of subjective responses. It involves systematically reevaluating the patient's responses, employing alternative questioning techniques, and confirming findings through objective measures where appropriate. This aligns with the ethical obligation to provide competent and accurate care, ensuring the patient receives the most beneficial prescription. It also implicitly adheres to guidelines that emphasize thoroughness and accuracy in ophthalmic testing. An incorrect approach might involve prematurely accepting a patient's initial response without further exploration, especially if it seems to satisfy a certain acuity level. This could lead to an suboptimal prescription that does not fully address the patient's visual needs or comfort. Another incorrect approach could be to rely solely on the patient's subjective statements without considering potential confounding factors or the need for objective confirmation, potentially overlooking underlying issues or leading to an inaccurate final prescription. A third incorrect approach might involve imposing the technologist's own interpretation of what the patient should see, rather than strictly adhering to the patient's reported experience, which is a violation of patient autonomy and the principle of accurate data collection. The professional decision-making process in such situations requires a systematic approach. First, actively listen to and acknowledge the patient's responses. Second, employ a variety of questioning techniques to clarify ambiguities. Third, consider the clinical context and the patient's history. Fourth, if subjective responses remain inconsistent, consider objective verification methods or consultation with the supervising ophthalmologist or optometrist. The ultimate goal is to achieve the best possible subjective refraction through careful, ethical, and evidence-based practice.